The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. I'm Denis Thompson, your host. And for those of you who are not familiar with the show, during the show we like to discuss the ARP Wave neurotherapy system. It's a totally new way of looking at pain. It's a totally new way of looking at therapy. And what I mean by that is that we're looking at pain and therapy as a neurological phenomena, not a physiological symptom. So think of it this way. Wherever you have pain, wherever your MRI, X-ray, CAT scan, or any other image, such as an ultrasound, says you have a problem, is where that problem ended. It is not where that problem is coming from. And unfortunately, most of us are treated where the problem ended and on the symptoms. And therefore, it might feel good for a while, and then all of a sudden the symptoms come back. Because really, it's a lost art to find out where the problem is coming from instead of where the problem ended up. So the ARP Wave neurotherapy system does just exactly that. It finds out where that pain is coming from. It finds out the answer to the question, why? Why is my knee bone on bone? Why does my elbow hurt? Why does my wrist hurt? Why does my shoulder hurt? Because unless you can answer the question, why, you will never solve the problem. And I can assure you the majority of therapists and the doctors that you've seen over the past years are extremely skilled. But they're skilled in where? They are not trained and or skilled in answering the question, why? So for an example, if you're bone on bone and in your mind you've been expressed, well, the reason you're bone on bone is because you've been very active throughout your life, or you've overused your knee, or you've been involved in an injury and that created an arthritic condition, and so therefore you're eventually going to be bone on bone and have pain. Well, those are absolutely 100% true statements. However, there's one missing piece in that statement, and that is, why? Why am I bone on bone? Why do I have arthritis? Why does all this overactivity bother my knee and created this problem? And the answer is not that you overworked. The answer is not that you have arthritis. The answer is not that you just mystically ended up with this. The answer is a completely different answer. And that, in fact, is what neurotherapy is all about, finding that answer. So many of you have asked me, just exactly what is the neurotherapy? What is it? I've never heard of it before. Why doesn't my doctor have it? Well, in the very near future, your doctor will have it. And one of the reasons that I'm on this show is because over the last 15 years, we've been a provider of these services to over 75,000 people all over the world with better than a 95% success rate. And what I mean by success rate is taking people out of pain and allowing them to move freely without pain. And in that 75,000, we have many of the world's most elite athletes as clients, thousands and thousands to be exact. But athletes aren't our number one client. You are. And the reason you are our number one client is because there's more of you than them. It's that simple. So at the present moment, what we're doing is we're shifting our company emphasis from being a provider of the services and having clinics throughout the world doing it that we own or operate. We are now setting up the nation's largest network of surgeons, doctors of all types, all disciplines, to offer and administer neurotherapy, to add it to their practice. So if you're a practitioner out there, if you're a surgeon, if you are a doctor of any discipline, we offer you the opportunity at absolutely no cost or obligation to see if this therapy will work in your practice. Because what I'm about ready to say on this radio show, you and every listener on here is going to have a hard time believing. And the reason for that is we only believe what we know. And if you do not know about neurotherapy, then you are not going to believe neurotherapy. So until you see it, feel it, and experience it, no matter how many tests we have, no matter how many testimonials we have, you will never know if it is absolutely something as good as what I say it is. So my offer to you as a practitioner, if we have a representative in your area, they'll come out, they'll treat a couple of your patients. Could be anybody in your family, could be you, could be any of your very difficult case patients. And at the end of that treatment, if it does what I say it does, and you'll know immediately, and so will the patient, then you agree to become one of our providers. It's fully covered by insurance, and we'll go over all of the details with you. If you're a patient listening to this right now, I would suggest as soon as this radio program is over, you contact your doctor and ask them point blank, do you offer the ARP Wave System neurotherapy? And if they say no, say you'd like to be treated by it, and ask them if they would be, if they would, agree to having you treated in their facility. If that in fact is the case, and we don't have a provider in your area, we will basically send that doctor everything he needs to treat you, and we will oversee that treatment with the understanding that if we treat you and it does what we say it does, that you tell the doctor you want him to do therapy on you in his office. Certainly a fair offer. So if you have any questions, or if you would like to set up a trial for yourself, whether you're a provider or whether you are an individual in pain or have restricted range of motion or been told you need to have surgery, then call our local number. That number is 954-256-0045. Or you can ask any question you'd like on the web at painmanagementnetwork.com. That's painmanagementnetwork.com. So now, back to what neurotherapy is. Well, what it is it answers the question, why? And people always ask me, well, how do you do that? Well, it's real simple. If you're an accountant and you look at a balance sheet and the numbers are off, you don't just change the numbers. You have to find out why the numbers are off. But in medicine and in therapy, we don't do that. What we do is we treat the where. We do not treat the why. Neurotherapy allows you, the practitioner, and you, the patient, to be treated with or by a system which is done in addition to, not in subtraction of, everything else you're doing. And this system answers the question, why? So let's get back to bone-on-bone as an example. Why am I bone-on-bone? Well, the answer is a very simple but yet complex answer. And I know that sounds kind of like, tongue-twisted conversation. But no, it really is. It's simple, but it's complex. And what I mean by that is, it is a neurological reason that you're bone-on-bone, not a physiological reason. As an example, your nervous system, which drives everything in your body, fires your muscles. If your nervous system is not firing your muscle fast enough, if it's not getting an appropriate signal to those muscles cannot turn on fast enough to absorb force. And because force is always coming into the body, and because the muscles are always there to act as a shock absorber, if those muscles are not turning on fast enough, then all of that force is going to go to your joint. And just a matter of time before it literally wipes out everything, your cartilage, the fluid, the tissue, and all of a sudden you're bone on bone. So now the solution is what? Let's put a brand new knee in. Well, that's a solution to the problem, but it doesn't solve the problem because it's a solution to the end of the problem, not the beginning of the problem. The beginning of the problem was that the nervous system is not and was not sending the appropriate signal to the muscles to allow them to absorb force. So in other words, you are a car without shock absorbers. And I don't have to tell you what's going to happen to a car over a prolonged period of time if they don't have shocks. You're going to have significant damage. The force is going to go to the frame of the car, just like the force is going into your frame, your joints. So, with that in mind, how does the ARP Wave neurotherapy system find that? Well, we use a proprietary tool, proprietary techniques, and we identify and scan exactly where the neurological breakdown in your body is causing the electrical short going to your muscles, which allow your muscles to do what they are in fact supposed to do, which is absorb force. We'll be right back. I hear our sounder right now, and we'll get into just exactly how we do that. But if you'd like to experience this, listen very carefully.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back. So you just heard how you, whether you're a provider or whether you're a patient, can actually see the ARP Wave neurotherapy in action. And only when you go through that process are you truly going to understand the dynamics and the total differentiation between neurotherapy and physical therapy. They're dramatically different and complement one another tremendously. They are not competition, they are addition. So let's talk a little bit about that bone-on-bone problem. And how does the ARP Wave neurotherapy address it? Well, let's start by, again, talking about the neurological origin of that problem is a disrupted signal going to the muscle, allowing that muscle not to do what that muscle is supposed to do, which is absorb force. So over time, that force is going to consistently go into your joints, and you're going to eventually have a problem and be ending up bone on bone. What we do is, and I'll take you kind of through a treatment. I'll walk you step by step through exactly what you, the provider, will be educated in, and you, the patient, will go through. So the first thing that we would do when you come into the doctor's office is we would go through a complete history of all of your issues. Issues meaning any place you believe you have pain, any place you believe you have restriction in range of motion, anywhere. And we're going to ask a lot of questions, in addition to what the doctor has already asked, because we're going to bring you all the way back to the very first time you ever felt that symptom, not when you last felt that symptom. So let's say you first felt your knee as a child when you were running, and you really never thought anything about it. And then 45 years later, the same place you felt your knee when you were a child is where it really is bothering you now. So if you're a patient, I want you to be thinking back about the very first time you ever felt even the least little bit of discomfort in the area that is tremendously troublesome to you right now. So that's the first thing that we do. The next thing we do is we explain to you as a patient that everyone else that you've seen up until now are extremely skilled at what they do. But what they do is what they learned how to do. And what they learned how to do is address where the problem ended up. They were never trained in how and where the problem was coming from. That is not part of their training. What we're going to do today is we're going to identify exactly where that is. So the first thing that we're going to do after we get your complete history and after we get you to think about the very first time that you ever had those symptoms, no matter how small they were, no matter how long ago it was, and it's going to take you a while to think about that. Then the next thing we have to do is, since we're dealing primarily with your nervous system, we have to make sure that your nervous system is working or isn't working. Now, if you have pain, we can almost guarantee you it's not working, but we're not going to make that assumption. So we're going to do a very simple diagnostic test. As an example, we're going to lay you down on a treatment table. We're going to elevate your right leg as an example, and we're going to ask you to put light resistance as we put light force on your shin. and you're just going to try to prevent us from pushing your leg down. We're going to put very light force on your leg. And if your muscles turn on very quickly the minute we touch you, then we know that that side is working. And we do the other side the same way. And then we're going to have you arch your back and do exactly the same thing. Now, probably 85% of you, no matter who you are, no matter what you do, no matter what level of pain you have or don't have, are going to fail that test. I can go into any building, any professional athletic organization, any company, and give this test, and I'll tell you point blank, 80 to 90% of the people are going to fail the test. That means, providers, 80 to 90% of the people walking around on this planet are not neurologically firing their muscles correctly to absorb force, which means you're eventually going to see them, one way or the other. So patients, if you go through this test, I can almost guarantee you 80 to 90% of you are going to fail the test. Now, what does that mean? Well, what that means is that, remember that first time you felt that symptom? Let's say you were 10 years old and you were running and you felt your knee and you went to your mom and dad and you said, wow, my knee is really bugging me a little bit. And what do? You put ice on it, and, it's just a part of being a kid, and all of a sudden it starts to go away, and then 5-10 years later it bugs you a little bit more, and then it goes away, and then 10-15 years later it gets really bad and it doesn't start going away, and now you're here where you're at right now. Well, when you were 10 years old is probably when your nervous system stopped working correctly. So we have now a timeline. So if you're 50, we got 40 years of force going into your joint that's not supposed to be going there. Is it any wonder you might have a problem? So if you look at it that way, you look at it analytically, now we've identified, okay, where's the electrical short? Where did that start? Well, it started here. And how do we find out? We use a proprietary tool, a proprietary technique, and the first thing we have to do is we have to get your nervous system back in balance. Now, no amount of adjusting, no amount of therapy is basically going to do that, because this is a neurological function, not a physiological function. And anything you've done up until now, short of possibly chiropractic, is not going to address your nervous system. So what a chiropractor does is basically they adjust you, they fire the nervous system, but you know what? It doesn't mean that that signal is significant enough to fire your muscles to do what they're supposed to do. Henceforth, you get temporary relief. Or, if you get permanent relief, then you've reinforced it by doing something else on the neurological side. Just that simple. So the first thing we have to do is we have to basically turn those switches on. And we created protocols and very unique therapy to do that. It takes roughly about, maybe 5-6 minutes. And in that 5 or 6 minutes, you, the patient, will feel absolutely nothing. And we explain to you it's kind of like resetting a computer if it ever went blue screen and crashed on you. First thing you have to do is turn it off. Next thing you have to do is reboot it. Next thing you have to do is reset it back to its original settings. We've created a protocol to reset your original settings back to the very first thing you ever learned how to do, which is how to crawl. That's the very first cognitive task you ever learned how to do. So we're going to reset you back to that task. Okay, so now, a simple analogy in play here. Now we've got the shock absorbers working. But you know what? They haven't been working for maybe 10, 20, 30, or 40 years. So there's going to be a lot of damage caused if those shocks haven't been working. And if you have pain, those shocks have not been working. So now what we have to do, now that the nervous system is working correctly, now what we're able to do is transfer the force distribution going into the joint, which is bothering you, or the fracture, which is bothering you, or the tear, which is bothering you, and we transfer that force out of that tissue into the muscle. Guess what happens to your pain? It goes away. Why does it go away? Because there's no more force going to the area that's causing the pain. So wherever you have pain is where the problem ended. It is not where the problem is coming from. So now you've gone through the system. We've gotten your nervous system firing using our proprietary technology and our proprietary techniques. And now we're going to use that same technology to find exactly where that signal breakdown is. Once we find that neurological breakdown, we're now going to start to treat you. And we're going to treat you with this proprietary tool and these proprietary techniques. And we're going to break all of your patterns of movement that you're doing incorrectly right now. So if you don't think you're doing an incorrect movement right now, get up out of a chair if you're sitting in a chair. And let me tell you what I'm going to see when I watch you get up out of a chair. The first thing that's going to happen is your torso is going to come forward. You're going to lean forward. The second thing that's going to happen is your knees are going to go forward. The third thing that's going to happen is you're going to use momentum to stand up. Now, I submit to you, most of us are going to get in and out of a chair like that every day of the week. Well, now think about this. When you lean forward, where is all the force going? Well, it goes right to the middle of your lower back. So all of you who have back pain, the minute you lean forward, you're just exacerbating that back pain. Now, for those of you who have knee problems, look down as you're getting out of a chair and tell me where all the force is going in you. It's real simple. It's going right in the front of your knee. Where does it hurt you? Where does it bother you? It bothers you right in the middle of your knee or below your knee. You've been diagnosed with everything underneath the sun. The bottom line is, every single time you get out of a chair, you compound your problem. So, we got to break that habit. How do we do that? We neurologically re-educate you to break that pattern you've been in for 10, 20, 30, or 40 years. And when we break that pattern, guess what happens? Now when you get out of a chair, your torso is erect, you're at a perfect right angle, the muscles are absorbing the force, and guess what? You have no pain. Now, unfortunately, every single person on this radio station right now is incapable of doing that on your own. However, if you did it on your own, you would not have the pain that you have right now. And I can prove that very simply to you. Just walk, if your knees bother you right now, get up out of a chair, walk over to a door, open the door up, put one hand on the inside of the handle and one hand on the outside of the handle, put your feet close to the door, push your glutes to the rear, that's your butt, push your butt to the rear, and here's the rules of the game. As you go down like you're going to be sitting in a chair, your knee cannot go forward of your ankle. So in other words, your hips have got to be back, your glutes have to be back, and when you're looking straight down at your leg, it's got to be at a perfect right angle. And if you do that, you will find that you do not have pain, even though you have screaming pain right now coming out of that chair. Why don't you have pain? Because all I did is transfer that force to where it's supposed to go. Try it. You will be utterly amazed at the results. And now listen carefully to how you can experience neurotherapy at no cost and no obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we're back. Now, this is Denis Thompson, your host, and I've just given you a challenge. If you have knee pain, and if you did it, you now understand force distribution is 99% of your problem right now. Now, if you'd like to go through this system, because again, keep in mind, the only way you're going to know if this therapy can work for you is to actually try it. And we're setting up providers all over South Florida just so you can do that. Providers, we have patients for you. We'll have a lot of patients after this show. So please give us a call if you're a provider at 954-256-0045. If you're a patient and you would like to try this, call your doctor. If they do not agree to let us treat you in their office at no cost and no obligation to either of you, then call us back and we'll set you up with a provider in your area who will. Because my goal is to help as many of you as I possibly can. And the way to do that is reach out and let you experience the ARP Wave System neurotherapy, in addition to everything you're presently doing. Then and only then will you understand the difference. So, if you did that test that I just gave you, you saw immediately that the force was transferred. Now, let me kind of give you an idea of how that works. You see, you can't do that on your own. Because you remember how I said, think back to when you very first felt those symptoms? At that point in time, you lost the ability to keep that force out of that area. And it could be, like I said, 10, 20, 30, or 40 years ago. You are not going to break a 30, 40, or 10-year-old pattern by yourself. Impossible. If you could, you would have already done it. So as we're going through the therapeutic process, that is exactly what we are going to be doing. We are going to change your movement pattern. We are going to redirect the force coming into the area that is bothering you, and we're going to direct that force into the area that it is supposed to be going into. And you, your physical therapist, or any other therapist, is not going to be able to do that because it is not a physical pattern. I'll give you an example. You go to a doctor, and we've met with many of the pain intervention specialists. You go to a doctor and have any type of shot, or you take any kind of medication, and now you don't feel pain, but you still move wrong. And because you move wrong, you're not solving the problem. All you're doing is hiding the problem. Medication is tremendously effective at masking the symptom of pain. But until you do two things, you're not going to get rid of that pain. And I'm talking about getting rid of the pain without the medication. I'm talking about changing your life without medication. I'm talking about allowing you to move freely without pain at any age, no matter what your issue is. How? To basically break the neurological pattern that consistently keeps sending the wrong signal to the wrong muscle to do the wrong job. And you cannot do that in any therapy that I know of, and I'm the one that created this therapy, unless it's neurotherapy. So providers, what we're going to be doing with the patient over a period of 20 sessions is every single day we're going to be neurologically retraining the muscles on what to do correctly, redirecting the force out of the damaged tissue, increasing blood supply to the damaged tissue, and you know, and I know, that if we increase blood supply and take force out of the area, tissue is going to heal very quickly. And as it heals, we have no pain. But the key is we have to neurologically break you of your pattern. So when you get up out of a chair, and after you've gone through 20 sessions of neurotherapy, you're going to get up out of a chair, and your torso is going to be erect. You're always going to sit in a chair at a perfect right angle. Your feet are going to be straight ahead. They're going to be in a direct line with your knee, your hip, and your shoulder. When you stand up, you're going to be using your legs to stand up, not your back. You're going to be using power from your lower extremities to get you upright, not momentum. And when that happens, you are not going to have knee pain or back pain. Why? Because there's no force going to the knee or the back. And if there's no force going there, you're not going to consistently keep sending the signal that you need to protect it with the inappropriate muscle reaction causing the pain. So practitioners, what we do over those 20 sessions, which are fully billable by insurance so the patient does not need to pay, is this. We neurologically re-educate the patient on how to move. We increase their ability to absorb force using our proprietary technology and our proprietary techniques, all of which you will be trained in. Not you, but one of your staff members. This is something we don't want doctors doing. This is something we want the staff member to do. So in your very first treatment as a patient, you're going to see exactly what the end result of 20 sessions is going to be. Because if you come into that session and you've got a pain level of, say, 5 up on a scale of 1 to 10, and 10 is really high and 1 is very low, and you're coming in with pain around a 5 to a 10, when you leave, you're not going to have a whole lot of pain. You're going to have what I call mobility pain, which would be 1 or 2. Now, it's going to come back. Why is it going to come back? Because we have not broken you of your habit. See, what we've done in that first therapeutic session is we've taken your muscle from a concentric contraction, which means it's bunched up, it's protecting you. It's kind of like a fist. And if you want to know what I'm talking about, just put your hand right now and put your hand into a fist. That's what your muscle is like. And then what we're going to do is we're going to basically allow that muscle to go to eccentric contraction during the therapeutic session. So if you want to know what that is, open your hand. Now, when your hand is open, there's no pressure in the palm of your hand. When your hand is closed, there's light pressure in the middle of your hand. That's what every single one of you are feeling right now. If you're in pain, your muscle is in concentric contraction. It's protecting you. It's doing what it's supposed to do. Because you told it to do what it's supposed to do by your movement pattern. So we're going to break you of your movement pattern, and we're going to increase the ability of that muscle to go to eccentric contraction. The second that happens, you are not going to have pain. You're going to think as a patient, oh my goodness, I'm cured. You're not. Because in about 2.5 hours after your first treatment, that muscle is going to go right back to where it feels comfortable. Because it doesn't feel comfortable, and it's not a pattern of comfort until you go through therapy in eccentric contraction. Its comfort level is in concentric contraction, and your movement pattern consistently puts it there. So we've got to do 2 things. We've got to change your movement pattern, neurologically re-educate you into doing a completely different movement pattern. And if you'd like to know what that is, if any of you listening to this right now have a 2 or a 3-year-old running around, take a look at them. That's exactly how we're going to have you. Watch them when they pick something up off the ground. That's exactly how you're going to pick something off the ground. Watch them how they stand up. That's exactly how you're going to stand up. You know why? Because they don't know how to do it wrong. You do. So what we're going to do is we're going to bring you back to efficient movement. And when we bring you back to efficient movement, we're transferring the force out of damaged tissue into muscle, which is supposed to be absorbing the force, keeping it out of damaged tissue. We're going to increase your blood supply. You're going to feel light as a feather when you're done with your first treatment. And then gradually those muscles will start to contract. But when you're done with that first treatment, that's exactly how you will feel at the end of 20 treatments. And ask yourself, can I live a quality of life? Can I move freely without pain? Can I do any activity I want to do, whether it's tennis, golf, running, jumping, swimming, whatever it is? Can I do that feeling the way I do right now? The answer is yes, you can. So you've already answered your question. I already know what the answer is. I've seen it happen 75,000 times plus. I know what the answer is. I need to show you what the answer is. And providers, trust me, when you first see this on your worst-case patient, you will immediately understand the difference between this and physical therapy. This is neurotherapy. And none of you, no matter if you're a surgeon, no matter if you are a neurologist, no matter if you're a chiropractor, no matter if you're an osteopath, none of you have been trained in neurotherapy. We'd like that opportunity. We'd like the opportunity to work with you to help every single one of your patients. And you've got absolutely nothing to lose. It's just another tool for you and your patients. It's fully covered by insurance, except Medicare in certain circumstances. And for every single one of you who are in pain right now, for every single one of you who cannot move the way you want to move, please do me a favor. Call this number immediately, 954-256-0045, and find out who the provider in your area is. If we don't have a provider in your area, the first thing I would do when I got off this show today is pick up the telephone, call your doctor, and say, Doc, I just heard about this therapy called the ARP Wave System neurotherapy. I'd love to be treated by it. They've agreed to treat me in your office if you agree to let them treat me in your office, so both of us can see the therapy in action. And if that doctor agrees to that, let us know. We'll get equipment out to them. We'll set it up. We'll walk their staff step by step through the internet over Skype from corporate office in Minneapolis, Minnesota. We'll walk them step by step through this process. South Florida residents, many of you have representatives in your area. Our representative who's been trained by us will come out. We'll bring our proprietary technology into the doctor's office. We'll do all of this at absolutely no cost to either of you, with the understanding of, if we take you through a treatment if you're a patient, and you see a change, which I know you will, but you need to see for yourself. When you see that change, you tell your doctor, this is something I definitely want to do here in your office. And provider, if we see that happening, you agree to become one of our providers. That is as simple as it gets. Because, folks, whether you're a provider or whether you're a patient, there's really only one way you're ever going to know if this therapy is going to do what I say it does, and that is to try it, and there's no cost, there's no obligation. So listen carefully to how you can try this fabulous new therapy.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida Provider Network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back. I'm your host, Denis Thompson. You're listening to Pain Free Today. And if you've been listening for the last 15 to 20 minutes, you now have the answer to how you can be pain-free today. Just simply pick up the phone, call and see if we have a provider in your area, or call your doctor and offer him the opportunity to see and experience the ARP Wave neurotherapy system in his practice by treating you. So I've been asked to answer some questions that we get via emails. And if you'd like to ask a question and we could answer it on next week's show, just simply go to the web and go to www.painmanagementnetwork.com. And you can ask any question you like, and we will do our level best to get to some of those on each show. We're not here to diagnose anything, so don't ask me to diagnose these questions. I am not a doctor. I do not diagnose anything. What we do basically is we can tell you what we've done for people in that same situation. As an example, I have a lady that wrote to me, and she says that she has been in pain for over 35 years. And the pain is in her elbow. And she's done everything she can possibly imagine. And her pain is still in her elbow. And her shoulder hurts. Now, her question is, listening to what you're saying, it doesn't appear that the pain would be coming from my shoulder or my elbow. Is that correct? And the answer is, I don't know. And I won't know until I treat you. But let's talk about the 10 to 15,000 patients that I've seen that have that very same circumstance, those very same symptoms. And let's talk about what we did with them, and then maybe it will spark an interest in this lady to where she can go and get the solution to the question, why? Why do I have elbow pain? Why do I have shoulder pain? Well, let me tell you this. Every provider on this program today that's listening has been taught in medical school that the long head of the biceps tendon cannot come out of the biceps tendon groove unless the transverse ligament is torn. And when you do an MRI and the MRI shows that the bicep tendon is intact, that's where it stops. So in going through the neurotherapy, the first thing we do, if you recall, was we need to determine, is the nervous system working correctly? And in this case, it obviously is not, because we wouldn't have pain if it was. So the first thing that we have to do is find out where that breakdown is and reestablish that connection. So we do a very simple test. So for Liz, the lady who wrote in on email, and for any of you who have pain in your shoulder, pain in your elbow, I just want you to do this very simple test. And here's what it is. You have to have two people to do this test. So what I want you to do is I want you to put your arms straight out in front of you with your palms facing down. And I want somebody, some member of your family or a friend, to put light resistance on your forearm as you're trying to resist. And if your arm comes down or gives at all, your nervous system is not working correctly, and it's caused usually, not all the time, but usually it's caused by the long head of the biceps tendon. So what we do in every single instance is we do that test. And anyone who fails that test, we've created a protocol, and we train the doctors on how to do this protocol, where we immediately shift the long head of the biceps tendon, and it goes back into the groove. Didn't come completely out of the groove, didn't tear, but it shifted. And when it shifts, it's kind of like pulling a plug. So if you have a computer and you pulled the plug on the computer right now, the computer is not going to work until you plug it back in. Well, the same thing with the biceps tendon. If the biceps tendon shifts either medially or laterally inside that groove, significant enough, it's going to shut down the neurological impulse to the front of the shoulder and the back of the shoulder. And when that happens, there's no shock absorbers going on. So guess where all the shock is going to go? It's going to go into the joint. It's going to go into the shoulder joint. It's going to go into the elbow joint. And then there's absolutely nothing you or any therapist is going to do to change that. Why? Because it is a neurological problem, not a physiological problem. The neurology is the muscles aren't doing what they're supposed to do. The physiology is the pain. So, put your arm straight out in front of you if you have a shoulder problem or an elbow problem. If you've been diagnosed with medial or lateral epicondylitis, put your arm straight out in front of you and have somebody push down on your arm. If your arm comes down, you need to get into one of our providers immediately, and they will, in fact, treat you with our technique, put that biceps tendon back in its groove where it needs to go, and immediately your anterior, your front of your shoulder, your posterior, the back of your shoulder, those muscles will start working. And the minute those muscles start working, the force is going to go into those muscles. And it's not going to go into your elbow, and it's not going to go into your shoulder. And guess what, folks? You no longer have pain. But again, you need to experience that for yourself, because what I just said is way, 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 way too good to be true. Unfortunately, it is true. And for those of you who have a shoulder problem, for those of you who have an elbow problem, you have the most misdiagnosed, most misunderstood neurological dysfunction that there is. And that is your muscles aren't getting the right signal to do their job, to act as shock absorbers to keep the shock out of your elbow and out of your shoulder. We see this a tremendous amount in professional athletes. Anyone who's ever played football, anyone who's ever played a contact sport, more than likely has gotten themselves into this position at some point in time. Why? Because those muscles are supposed to be doing a specific job, and for whatever reason, neurologically they were shut down, and when that happens, they're no longer able to do that job. And when you go through neurotherapy, and you go through those 20 sessions, and we break you of all your habits, because let me tell you what your habits are. If your right arm gave when you did that test, and you got pain in your right shoulder and your right elbow, I can tell you point blank that you're shifting most of the load of everything you do to your left side. It's just going to be a matter of time before the left side picks up where the right side left off, because you're overworking those muscles. And sooner or later, they're going to be at the end of their maximal tolerance, and they're not going to be able to absorb any more force, and now you're going to start the problem on the left side. We have to break you of that pattern. You cannot do that on your own. You cannot do it with medication. You cannot do it with physical therapy. You cannot do it with exercise, because it is not a physical problem. It is a neurological pattern that has to neurologically be retrained. And until you do so, you have not solved the problem at all, nor will you ever solve the problem at all. So, Liz, my recommendation is please give us a call at 954-256-0045. Ask if we have a provider in your area. Tell us who your doctor is, if he's in the area. or she is in the area, give them a call. Ask them if they would agree to have you treated in their office with the ARP Wave System neurotherapy. No cost, no obligation to either one of you. And we'll do that. And that's a tremendous investment on our part, a tremendous investment of time, energy, and dollars to do one thing and only one thing, to show you and the provider, your doctor, beyond a shadow of a doubt if what I'm saying is true. And if it is, then you, the patient, agree with the doctor that you're going to go into therapy. And if you're the doctor, you agree to become one of our providers so you can give them the therapy. Just that simple. And we're setting up the nation's largest network of providers. If you're a surgeon, if you're a neurosurgeon, orthopedic surgeon, if you are a doctor of any discipline, we have patients for you, and you have patients that we together can make a tremendous change in their results by simply adding neurotherapy to your practice. So give us a call, and until next week, I'm Denis Thompson, and live pain-free today.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.